Dear learners, happy to invite my channel. Today we will discuss about respiratory system, anoxia, hypoxia, non-respiratory functions of the lungs. Respiratory system is nothing but that is the respirations, that is breathing oxygen as well as the carbon dioxide, inhale and exhale process. Anoxia is a type of brain injury is caused by partial or depressions of the brain oxygen supply for longer than the compensatory mechanism designed to prevent neuronal death can occupy. The brain represents 2% of our total body weight, but it consumes 20% of all the oxygen in our body. The brain has limited capacities to store nutrients, which is why it demands a constant high level of oxygen supply. The reason for it, although the brain tissue is capable of resisting between 4 and 5 minutes without oxygen, significant damage can take place. Also, once the 15 minutes mark is suppressed, it's also possible that more than 95% of the brain tissue area is damaged. So, and some of the types, they are having the four different types of the anoxia: anoxic anoxia, anemic anoxia, ischemic anoxia, histotoxic anoxia. So, how do they are causes of anoxia? Anoxic anoxia usually happens when an inadequate amount of oxygen is taken in. So, anoxia, already you know that is the insufficient amount of the oxygen it will be present in our body. It causes due to altitude sickness, drowning and or choking, strangulations, airflow obstructions to the lungs. These are the main causes. Anemic anoxia, oxygen supply to the brain can be affected by a lower capacity to oxygenate hemoglobin. Anemic, it's nothing but it already everyone know about, that is the blood related. Okay, the supply of the hemoglobin, the supply of the oxygen in through the hemoglobin, that it's called as oxygenated hemoglobin. So these oxygenated hemoglobin, the lower capacity, it causes due to the genetic conditions affecting red blood cells or by a severe anemia. The next one, ischemic anemia, inadequate supply of oxygen to brain tissue due to a reduction in the amount of blood flowing to the brain or in blood pressure. It causes due to the several reasons such as stroke or brain hemorrhage, severe hypertension, or sometimes it's called as some reasons cardiac arrest. This type of anoxia is more frequent in newborn babies. It's very severe. It's very careful to this type of the disorders. Last one, histotoxic anoxia. The word, the title, they indicates that is a toxic. So the reasons of this type of anoxia, most probably they happened, that is the toxic substance. So the reason the anoxia takes place when a toxic substance interfere with the capability of using the oxygen transported to the brain. So intoxication with the carbon monoxide, narcotics and some of the anesthetics tablets to leads to this type of histotoxic anoxia. Next we'll move on to the hypoxia. Hypoxia is a condition in which the body or a region of the body is deprived adequate oxygen supply to the brain tissues. The distributions to any part of the roles in blood or oxygen supply can lead to the hypoxia. The hypoxia is nothing but it is a condition in which the body or region of the body is deprived of adequate oxygen supply to the brain tissue. This is called as hypoxia. Hypoxia is also, they are classified into the several types, especially the mainly the hypotoxic hypoxia, localized hypoxia, and also they are affected in tissue and organs. And some of the causes of hypoxia, they are majorly for different types of the causes. They especially, one part is the no blood supply to the brain, and another part low blood supply to the brain. This is the main reason for this type of the hypoxia. There is no supply of the blood supply to the brain, low blood supply to the brain. So no blood supply to the brain, this occurs when the blood vessels that supply to the brain with blood completely arrested, completely obstructed. It's very rare. But low blood supply to the brain, the low blood supply can occur when even a single blood vessels is blocked, partially obstructed, as often happens with a stroke. And what are the symptoms? What are the symptoms of the hypoxia? Loss of consciousness, unable to speak, blue or white lips, tingling in the extreme lights, hyperventilating, not breathing, not feeling well. So these are the uh, symptoms of hypoxia. What is the treatment? How will it will be treated with the hypoxia? The hypoxia, it is a demands emergency treatment. The emergency room visits number 911. It can be save the person's life. So dopamine technique may also slow brain damages. These are the anoxia as well as hypoxia. I hope these part of the content will be clear. Then next we'll move on to that is non-respiratory functions of the lungs. In addition to their functions in gas exchange, the lungs have a number of metabolic functions. Defense mechanism, maintenance of water balance, it's a main part of this non-respiratory functions of the lungs. This is the major part. Defense mechanism, maintenance of water balance, regulations of body temperature, regulations of acid base balance, metabolism of biologically active substance. Why they are, it's called as a non-respiratory functions of the lungs, because of these are involved to the from main metabolic functions. So liver is the main metabolism process, it will be occur, but this defense mechanism, maintenance of water body balance, as well as the regulations of body temperature, regulations of acid base balance, and also the biologically active substance of the metabolism, it's a main role. So the non-respiratory functions of the lungs, it is the sensations of smell, warming and humidifications of air, phonetations, filtrations of blood at the pulmonary capillaries acting as a volume reservoirs of blood, metabolic functions of the pulmonary tissue, and also they involve to the fluid exchange. They maybe it is correlate with the digestive system and also the drug absorption. The next one, that is a main part, already I told that is a defense mechanism, filtration, cleaning mechanism, pulmonary circulation and metabolic functions. Thank you.